depending on what you want to achieve with your patient. You can either set so that you're encouraging external rotation of the thigh or internal rotation. And you do that by setting their pelvis relative to the thigh. So if you ask the patient to step back, okay, now the leg's in relative external rotation, and if you tape it with tension in that position, it will assist in keeping the thigh from dropping in. So if your athlete's got problems with hip impingement, then this is the technique that you want to try. Alternatively, if somebody's got an adductor strain, you can bring them the other way. So if you ask them to step forward with that leg, okay, and then you strap them in that position with the leg relatively rotated into the pelvis, okay. For the purpose of this video today, we're going to do an external rotation, so if you can ask Mark to step back. Okay. So, this technique now, you're going to use your 3-inch EAB. Ideally, you do this with the patient without underwear on, okay? Basically because once they're strapped on, you can't remove the underwear, so if your athlete needs to go to the toilet, we've got a problem. So, what we're going to do, we're going to put down the first anchor, okay? We're going to hook underneath, and you might need your patient to assist you to dress themselves up here. Perfect. Okay. Right. So, to assist the hip flexor, you can apply a little bit of tension here, okay? But most of your tension wants to be coming in this angle so that you're assisting the leg to externally rotate. Then lock over again where you've just been. Okay. Again, a little bit of tension across the front. Okay. But again, tension mainly here at about 10%. Hooking round. If you suspect that this patient had an inguinal hernia, you can apply a pad into this area over the inguinal line. And you can also combine it with strapping technique on the opposite side. And applying tension across the front of the pelvis also helps to alleviate pubic symphysis pain. Lock or fat treatment of that technique. Okay, and we're done. For comfort of the patient as well, you probably want to put some Vaseline inside the thigh just to prevent friction.